Honorable Mark Brantley, Minister of Health, Chief Medical Officer, Dr. Patrick Martin, Medical Officer of Health, Dr. Julie Nisbet, Director of Community Health Services in St. Kitts, Dr. Retna Walwyn-Brown, Manager of the Nevis Solid Waste Management Authority, Mr. Andrew Hendrickson, Mrs. Nadine Carty-Keynes, HIV/AIDS Coordinator and Representative of the Health Promotion Unit, Ms. Chevene Nisbet, Health Educator, Mr. Anthony Webb, Environmental Health Officer, other members of staff of the Ministry of Health and the Nevis Solid Waste Management Authority, other partners including the Nevis Disaster Management Department, the media, good morning. Strategic objectives of the Ministry of Health in 2016 include a reduction in the incidence of preventable diseases through primary healthcare interventions geared towards individuals, families, and communities. The Mosquito Prevention and Control Program is one such way that this objective will be achieved. Through this brief press conference, the public will be informed of the various health promotion strategies and other measures necessary to prevent Zika and other vector-borne diseases. You will also be informed of the Ministry's response to date with respect to Zika and our responsibility with regard to vector control in general. Our panel includes the Medical Officer of Health, Dr. Julie Nisbet, the Chief Medical Officer, Dr. Patrick Martin, the Manager of the Nevis Solid Waste Management Authority, Mr. Andrew Hendrickson, Mrs. Nadine Carty-Keynes of the Health Promotion Unit, the Honorable Mark Brantley, Minister of Health, Chevene Nisbet, Health Educator. You'll also hear from Anthony Webb, Environmental Health Officer. We will move straight into the press conference and hold all questions until the end. We begin with Dr. Nisbet, who will discuss the purpose and objectives of the campaign. Dr. Nisbet.
Madam Chair, allow me to adopt the protocol that has been established, and good morning to everyone. The mosquito is one of the most important vectors of disease living among us. They are responsible for the transmission of diseases such as dengue fever, which is endemic in our region, yellow fever, which is endemic in some Central and South American countries, lymphatic filariasis, or elephantitis, and malaria. We have seen recently the emergence of new mosquito-borne diseases in our region. Chikungunya virus infection in 2013, which started in 2013, which caused illness in many persons in this region. And close on its heels in 2015, Zika virus infection, which has been declared a public health emergency of international concern by the WHO. The Ministry of Health, therefore, deems it important to launch a campaign focusing on the prevention and control of all mosquito-borne diseases. We have therefore chosen to broaden the OECS theme of Eliminate Breeding Today, Keep Zika Away, to an in-country theme of Eliminate Breeding Today, Keep Mosquitoes Away, since many of the 11 mosquito species identified on Nevis are potential vectors. Though much of our focus will be on the control of Aedes aegypti mosquito, we must always be reminded of the other potential vectors. The objectives of the campaign are: 1, to reduce or interrupt the transmission of mosquito-borne diseases through an integrated vector management approach. Number 2, to enhance the skills of citizens and residents in the prevention of mosquito breeding and disease transmission through increased health promotion activities. 3, to enhance surveillance of mosquito-borne diseases, complications of these diseases, and prevention and control programs. Several strategies will be employed to realize these objectives. These will include increased premises inspections, integration of non-chemical and chemical vector control methods, capacity building of vector control and environmental health officers, use of the Geographical Information System, GIS, in vector control programs, community mobilization, and of course, risk communication strategies. Mrs. Keynes will elaborate more on the risk communication strategies during her presentation. The Ministry of Health expects to make a great impact. We will monitor and evaluate our efforts through improved syndromic and communicable disease surveillance, vector control surveillance, case investigations, and analysis of our data. The campaign will only be successful if there is collaboration within the health sector, with other sectors, and with community participation. I therefore take this opportunity to encourage all citizens and residents to get on board and let us eliminate breeding today. Keep mosquitoes away. Remember, no breeding sites equal no mosquitoes.
Thank you, Dr. Nisbet, for informing us of the objectives of the campaign, which focus on education, surveillance, and the use of technology, including GIS. We now move on to Dr. Patrick Martin, who will speak about the epidemiology and clinical aspects with regard to Zika. Dr. Martin.
Thank you, Permanent Secretary, Honorable Minister, colleagues. St Kitts and Nevis, both islands, exist in a single health space which extends through the OECS because we have freedom of movement. And so, as Chief Technical Officer in Public Health, I'm happy to be here among colleagues to review the Zika situation. There are no confirmed cases of Zika in the Federation. No as in NO. Over the past 2 to 3 weeks, however, 12 samples have been sent to CAFA for testing. All have returned negative for Zika. That being said, we have the vector. The vector, the Aedes species, and so all it requires is for someone to come into the Federation who shows no symptoms but has the virus circulating in their body. The Aedes bites them, and then the bite comes our way. But we also have to pay attention to the sexual transmission of Zika that has been proven. Also, Zika can be contracted if a person receives transfusion of blood that is not tested. Finally, the unborn could be exposed to Zika during a pregnancy and during the birth process. These situations are well known to clinicians in St Kitts and Nevis by virtue of the fact that we are linked in real time to the Caribbean Public Health Agency, CAFA, and the Pan American Health Organization and World Health Organization. So we are linked in real time to the latest information that is available in the world. Symptoms of Zika include fever, joint pain that is much less than the joint pain in chikungunya. Chikungunya, which comes from the Makoti people in East Africa, chikungunya means that which bends you up. And the reports from persons who had chikungunya is that they were bent up all out of shape, but the Zika pain is much, much less. There's also a rash and a red eye without a discharge. So those are the clinical clues that will alert the astute doctor or nurse or anybody else to the fact that a person may have Zika. Many infected persons, up to 80% of infected persons do not show symptoms. So Zika is a mild illness for the most part. However, there are some complications that we have to pay attention to. One is Guillain-Barré syndrome, GBS, which is a well-known disorder, post-infectious disorder. After an infection with a virus or bacteria, some persons develop a paralysis and weakness of the muscles, which starts in the lower extremities and works its way up. and in worst case scenarios can affect their breathing muscles, and they require mechanical ventilation in an ICU. So clinicians on both sides of the channel are aware of that, and the ICUs are on standby in the unlikely event that we have such a case. Worst case scenario calculations call for 1 or 2 patients of Guillain-Barré syndrome in the worst case scenario. Chances are we'll never have one because we have small numbers. Our population is 50,000. However, everybody in St Kitts and Nevis has seen the images of babies born with small heads in Brazil. Some of the media, international media reporting, to my mind, is very alarmist. You don't get the true picture. And so there are persons in St. Kitts and Nevis who believe that every baby will be born with a small head. So I'm here to say that is not true. It's also not true in Brazil. Brazil has 250,000 newborns every month, and they do not have 250,000 babies with small heads. Matter of fact, the current rate in Brazil is 1 baby with a small head for every 1,500 newborns. So if we translate that formula to St. Kitts and Nevis, it will take 2 to 3 years before we get a baby born with a small head. Notwithstanding, we have babies who are born with small heads because of exposure to alcohol, certain drugs, and certain other infections like syphilis and herpes, and also marijuana and cocaine. All right, so babies born with small heads, that's not a new phenomenon to St. Kitts and Nevis. But we just want people to take a deep breath and relax. If you're pregnant right now, have no fear. Knowledge is power, and pay attention to the information provided to you by your nurse, district nurse, community nurse, or your private doctor if you have one. So the implications for St. Kitts and Nevis are very clear. We have an open border. People are free to move in and out. We hope people come in to do some business, to add to the economy, but infected people can come into the country. In fact, for every new disease that emerges in the world, our situation is one of importation of a new disease. New diseases are unlikely to emerge in St. Kitts and Nevis because our public health situation is second to none in the world. Why do you say that? A, clean air. B, clean water. C, fairly good solid waste collection and disposal. Decent housing, drainage. So diseases thrive, flourish, where there is unclean air, polluted air. People are drinking unsafe water. People are living in slums where there's inadequate drainage, litter, and poor waste management. Thankfully, we have moved past those days several decades ago through investment of taxpayer funds in the public health infrastructure of St. Kitts and Nevis. So I am very happy with the campaign. I'm happy that my colleagues in the Ministry of Health of Nevis have logged on with their colleagues in the OECS to be part of the OECS Health Communicators Network. And because we really have to make sure that the residents get the message. I think they already have the message, but we have to keep reinforcing it, because as you walk through Main Street and Government Road, people are going to ask, what is the ministry doing about it? And the correct answer is, the correct question is, what are we all doing about it? Because it's not a Ministry of Health response alone. So the number one breeding site for the mosquito, the Aedes mosquito, the number one breeding site is inside people's homes in containers such as these. And the number two breeding site is in people's yards. And we know some of our residents do not keep their yards as clean as the permanent secretary here. And so when the rain falls, and we had a good shower this morning, this mosquito requires only 1 drop of water to lay 3,000 eggs in 3 weeks. And so you will find the mosquito breeding in banana trees. Anywhere there is water close to a human being. This mosquito is not a swamp mosquito. It's a domesticated mosquito. My colleagues in environmental health call it a forward mosquito. It's forward, it's fresh, it's like fresh water, and lives in the domestic space close to people. So Zika, because of its international designation, is a notifiable disease. Practitioners are required by law to notify the Ministry of Health of all suspected or confirmed cases of Zika. I wish to end by reiterating some advice to pregnant females. And this advice is adapted from the US CDC and also from the Pan American Health Organization. If you're pregnant or contemplating pregnancy, please have a conversation with your healthcare provider. Excellent healthcare is provided in the community health centers of St Kitts and Nevis, and if you care to, also from your private physician. But for the avoidance of doubt, and since the information suggests that there might be a link between exposure to Zika or some agent surrounding Zika, just for the avoidance of doubt, you should take all necessary measures to avoid being bitten by the Aedes mosquito, which is active during the daytime hours from dawn to dusk. Those measures include using mosquito nets, inserting screens in windows and doors, wearing clothing that cover as much of the body as possible, and using approved repellents. Those are repellents that have peat, P-E-E-T, and picardin, P-I-C-A-R-D-I-N. P-E-E-T, peat, and picardin, P-I-C-A-R-D-I-N. Those ingredients have been deemed to be safe by the U.S. Environmental Protection Agency. So if you go to the store and you don't see peat or picardin, don't buy it. So until more is known about the effects of Zika on the unborn, pregnant females should postpone travel to areas where Zika virus transmission is ongoing. Now, having said that, some people must travel. So if you must travel, talk to your healthcare provider before you travel so that all of the measures, the prevention measures, can be reinforced. Any pregnant female of St. Kitts and Nevis who develops symptoms during or within 2 weeks of returning from an area where Zika is active should inform their healthcare provider so we can start the testing. Any pregnant female who does not have symptoms but who has traveled to an active area within the last 2 to 12 weeks, you should also come in for a conversation so we can make sure that everything is fine. And to let you know that in the unlikely event of an aborted fetus or a live newborn being born to a woman who was infected during the pregnancy, in those situations, we will also be evaluating the aborted fetus or the newborn. So you can be assured that the medical infrastructure is geared up and ready to assist you, but the emphasis is on prevention. No mosquito, no Zika. And wear your condoms. Thank you very much.
Thank you, Dr. Martin, for discussing the modes of transmission of Zika and the symptoms. At this time, we welcome the Deputy Chief Environmental Health Officer from St Kitts, Mr. Jermaine Lake, and Clester Roberts, Manager of the Alexandria Hospital Laboratory. We now move on to remarks by Mr. Andrew Hendrickson, Manager of the Nevis Solid Waste Management Authority.
Thank you, Madam Chair. Allow me to adopt the protocol already established. Good morning, colleagues.
Good morning.
At the Nevis Solid Waste Management Authority, our focus continues to be providing a supporting role to the program of eliminating or controlling mosquitoes. We have done this by implementing certain simple measures. And it has to do with community outreach and also the way how we collect our garbage out in the field. Now, in terms of the community outreach, we have 2 programs running currently at the Nevis Solid Waste Management Authority. And the first one has to do with every 3 months, we allow an amnesty for a 1-week period. And this allows individuals, householders, to clean their premises, to remove all of the old household items, white goods that would be collecting water and creating that breeding site for the mosquitoes. The amnesty allows them to bring their items to the landfill free of charge. And so our motto there is, you bring it, we take it. And the last amnesty finished Monday, the 21st, just gone. It lasted from the 14th of March to the 21st of March. And we are anticipating that we'll have another amnesty period, which will be sometime just before Culturama. And the reason for that is that we'll have many visitors, and we would like to make our contribution towards making Nevis cleaner, looking cleaner and being a cleaner environment, especially around that time. And the second part of the community outreach is that we encourage community groups. And some communities have exploited this option where we allow them free bin service. We have a bin rental service which is the roll-on roll-off bins, and it's a 10-yard bin that the truck would drop to your site, and you can load it, and we'll come and collect it and take it to the landfill. For the community leaders who have approached us, I know Cherry Gardens have done that, and Cane Garden, and a few others. We've allowed free bin service, and the communities can fill the bins. They can go to various yards that are not tidy and clean them up. And the focus is on white goods and household items, old galvanized and anything that can collect water. And we come and collect and empty as many times as necessary with no inconvenience, no charge. Then what we've tried to do, we've tried to educate the public in terms of punching holes in the bottom of their receptacles so that water does not collect. Now, that helps our loaders as well, because when the garbage is wet and when the bin is waterlogged and filled with water, it makes it difficult for them to handle, and it becomes a very messy job in more ways than one. So the emphasis is on allowing drainage. Now, we have expanded that program because we've launched a trash receptacle which is very porous, is animal resistant so far, and the reason for that is that we've made the bottom from pallets. The pallets that the blocks would come on, we've done that, and we've made them square, and they have been contributing towards a cleaner environment. There has not been any spillage, so we've controlled the donkeys, and we've also eliminated the breeding possibilities for mosquitoes. So, at the Nevis Solid Waste Management Authority, I am happy to say that we have been providing a wonderful supportive role to the health department and all the health initiatives that would help to eliminate these diseases that are borne by mosquitoes. Thank you.
Okay, thank you, Mr. Hendrickson, for your presentation, where you discuss your community outreach programs and the new bins which do not facilitate the breeding of mosquitoes as they reduce water collection. We'll now move to Ms. Nadine Mrs. Nadine Carty-Keynes of the Health Promotion Unit, who will discuss risk communication and raising public awareness.
Thank you, Madam Chair, and please allow me to adopt the protocol already established. For Health Promotion Unit, the task that we have to focus on is providing communication materials in various formats that is geared towards protecting the lives of all people against Zika and other mosquito-borne diseases, but it's also about protecting our livelihood. Therefore, we will be responsible for disseminating any relevant information provided through collaboration from our clinical management and, of course, our regional partners, OECS, CAFA, and the Pan-American Health Organization, about the prevention and control of mosquito-borne diseases such as Zika. We'll be focusing on the educational materials such as pamphlets, posters, banners, letters that will be sent to various organizations and establishments such as churches, the private sector, public sector, community organizations, schools. We'll also be doing community talks. We'll also be in the schools providing educational information, radio talk programs, and of course public service announcements via television and radio. We at the Health Promotion Unit have developed various materials that will be showcased today here at the end of the formal part of this press conference. And that will be presented by Ms. Stephanie Nisbet, our health educator. So there you would see exactly what we've been working on. Most of them are almost complete. Of course, we want to get it as perfect as possible, the message to be clear and crisp, so that we are educating our people on how they can eliminate mosquito breeding in their homes, in their yards, in their community, and by extension protecting us here, all of us here in the Federation of St Kitts and Nevis. It is not just the Ministry of Health task. We are here as persons to guide the process, but we need the commitment and the responsibility of each and every one of our citizens to do their part in protecting themselves, their family, and their community by eliminating mosquito breeding today so we can keep the mosquitoes away. Thank you.
Thank you, Mrs. Carty-Keynes. We discussed the dissemination of educational materials and also the partnership with various organizations. I also take the time now to congratulate the team. They have already started work with PTAs and PTA meetings, and also with partners such as the Tourism Authority. So the efforts are ongoing. We now move to a statement by the Honorable Mark Brantley, Minister of Health, who will discuss briefly on some of the policies that we already have in place with regard to mosquito-borne diseases. Mr. Brantley.
Good morning, Prominent Secretary Zach Liebert, and good morning to all the panelists and everyone else who's here. As Minister of Health in the Nevis Island Administration, I am very pleased to associate myself with this venture, this effort at mosquito prevention and control. I do realize that it is the occurrence of Zika and the announcements that we've heard in relation to Zika that has brought us here. But I want to be very clear that so far as we are concerned, this issue is not just about Zika, and I'm very pleased that in Nevis we have sought to expand the concept from eliminating breeding today, keep Zika away, to rather a wider concept of eliminate breeding today, keep mosquitoes away. I believe that all the experts on this panel have made it quite clear that from mosquitoes we get various types of diseases, not just Zika. And so while Zika is now the rallying cry that has brought us here, it is in our interest as an island, as a country, wider country of St Kitts and Nevis, to eliminate mosquitoes and to do everything we can to ensure that they are eliminated. I want to start by commending the Permanent Secretary, Dr. Judy Nisbet, Dr. Martin for being here, but also our people on the front lines in terms of health care, health awareness, Mrs. Nadine Carty-Keynes, who's at the Health Promotion Unit, and my friend Andrew, Hendrickson, who heads the Nevis Solid Waste Management Authority. Why do I say that? I say that because I think in our island, maybe it's human nature, we take our health for granted. And oftentimes we only become aware or are concerned when we develop a problem. The truth is that this administration has made it its rallying cry that prevention is better than cure. That so far as possible we will try and make every effort to prevent illness rather than seeking to treat illness. And these are the folks who have been on the front lines of that prevention effort. I want to therefore commend them, commend the Health Promotion Unit in particular, commend those in environmental health who go out, sometimes in tough circumstances, but are certainly out there on the front lines trying to educate the public. We have continued as a policy at trying to address prevention, trying to address education, and trying to say to our people that their health ultimately is our responsibility in the government in terms of creating the proper environment, but it's also their responsibility, and that each and every one of us has to play our part. In terms of mosquitoes, we have heard very clearly that the Aedes aegypti mosquito, which is the one of most concern here, is domesticated in the sense that it likes to be around you and I. And so it behooves us all as homeowners, whether we're on the construction site, wherever we are, the commercial sites, to ensure that we do not create the environment for that mosquito to breed and thrive. And that means doing all the things that we have heard, making sure that they're not breeding in your flower pots, making sure they're not breeding in empty containers around your property, empty tires, ensuring that you keep your property clean, ensuring that you cooperate with solid waste when they come, that your garbage is collected. I was very pleased to hear Andrew speak of the efforts that solid waste has been making. I think sometimes their efforts are taken for granted, but in reality, solid waste does a lot to ensure that the island remains clean, and by virtue of that, that the island remains healthy. And so, the simple tips that they've suggested, punching holes in your containers for garbage, etc., I think demonstrate that we can do some very simple things to ensure that we, as an island, and the wider nation of St Kitts and Nevis continues to be safe. This effort is now in relation to Zika. We have had previous efforts in relation to chikungunya. We've had efforts in relation to dengue. The bottom line is that I think that we need to have ongoing efforts in relation to mosquitoes. And so we need not wait until the world tells us that there's a problem with some new strain or new virus. We need to just be vigilant as a community and as a country and continue to do our very best to eliminate mosquitoes. And all of us, it is something that the children can get involved in. Encourage them, primary school age, listen, let us eliminate mosquitoes. Let us do all that we need to do in order to ensure that we don't have this outbreak of Zika here. Much of what has been said about Zika, we don't know. I think we know as much as we don't know, in the sense that what causes it, what are the consequences of it. We've heard of children being born with small heads, undeveloped brains. Whether there's a direct causal link or not is still unclear based on the information that I have. But as the old people say, an ounce of prevention is worth a pound of cure. And so rather than waiting to see if it's true or not, I think having had the indicators that there might be a connection, it behooves us again to do our best to ensure that we avoid any outbreak of Zika here. I want to, because I think sometimes enough isn't said, so I want to commend the strides that the government has made. And I say the government in an all-inclusive sense. The governments and successive administrations as well, because those that have gone before have also done a lot of work in this regard. And that is in relation to things like clean water. We take those things for granted. But that's really, in developing countries, a major issue. Not only do we have clean, potable water here in Nevis, we are investing and continue to invest even now considerable sums in ensuring that our supply is good, our distribution network is good. And so the people of Nevis have the benefit of clean water being piped into their homes. The work of the planning department in ensuring that proper plans are put in and that we, the people, are allowed to build in a particular way that adheres to the standards that have been set. Our own adherence to the Public Health Act and the requirements set out in that legislation. The work of our Health Promotion Unit and the continuous efforts that they make to educate the public in all facets, but of course now we're dealing with mosquito reduction and therefore in this particular area. The truth is that with solid waste, health promotion unit, planning department, water department, all of us are working together, and ultimately the goal is a healthier Nevis. And so I want to commend all who have participated. This government will continue to work closely with the OECS, will continue to work closely with PAHO. We clearly will follow the dictates of the World Health Organization. But at the end of the day, the message that I want to convey this morning is that our health ultimately lies within ourselves. The maintenance of good health, the prevention of some of these mosquito-borne diseases. We can do a lot as citizens to prevent this outbreak. Let me end by commending all again. I am very pleased to hear that so far the country has no confirmed cases of Zika. Let me say that again. So far the country has no confirmed cases of Zika. And I was aware that some had been sent off for testing. I was walking around with fingers and toes crossed, hoping for the best. And so I'm very happy that they've come back negative. And that's a good sign. It is my hope that we will get through this particular troubling period without any confirmed cases of Zika. But to do that, we need the public on board. We need the public's assistance. We need the people of Nevis and the people of St Kitts, by extension, to do the necessary things. Keep your yard clean. Look out for the mosquitoes and try and prevent them by ensuring that there are no open containers where water is settling. These are important initiatives. Cooperate with the health professionals, cooperate with solid waste, and let us together ensure that Zika doesn't get a hold here. Let us together ensure that we eliminate breeding today and we keep mosquitoes away. Thank you very much.
Thank you, Mr. Brantley, for speaking on the importance of prevention and individual responsibility for health, as well as the work done by various agencies to ensure that we keep the environment healthy and reduce breeding sites for mosquitoes. Also, at this time, welcome the Coordinator of Community Nursing Services, Ms. Ermin Jeffers. We now move to the presentations and demonstrations part of.
Good morning, everyone. We've heard that the slogan "Eliminate breeding today and keep Zika away." And without water, we cannot have mosquito breeding. And these are some of the containers that water can catch in and can facilitate breeding of the mosquitoes. You have tins and bottles and even coconut shells, tires, you name it. If there are tins on the outside, you punch holes in them before you throw them in the garbage. Your bottles on the outside, for example, you turn them down in the case. These sometimes you take home food from the restaurant, and after eating the food, you throw the container outside. The wind blows it away. It lodges in areas where you can hold in water, can breed mosquitoes. The tires, for example, you want to punch some holes in them so that the water can leak out if it catches in any water. Your containers filled with water you're going to use, for example, for watering the flower garden. You can add a tablespoonful of kerosene oil. Turn it up so that it creates a film on top of the surface of the water, so that the wrigglers or the larval form and pupal form of the mosquito cannot get to the surface to breed. All right. Check these areas. I personally would have seen mosquito breeding in the tray inside of the kitchen. All right. There's also a larvicide that is used by the health department as the vector control officers visit the different households. And once mosquito breeding is found in containers, they add a little bit of something we call ABIT. It is a larvicide, and that will destroy the mosquitoes in its larval form. Coconut shells, tree trunks, etc. All those can also breed mosquitoes. So we want to try as much as possible to eliminate any possible or potential container that can hold in water. What we find happens in the household though is that on every shopping list there is a bop or a baygon. All right. So you find that shoppers or householders going to shop, they always remember to buy a bop because they have mosquitoes in the house. All right. So they're taking care of the mosquito, the adult mosquito, in the house, right? But on the outside, you have all these, all right? They're catching in water, and they are breeding mosquitoes. You're not doing anything towards here, all right? And what is happening is that in time, these containers are causing mosquitoes in the house, replenishing the house then, all right? Okay, thank you.
We get the message of partnerships in order to be effective and achieve our theme of eliminate breeding today, keep mosquitoes away. But before we wrap up, I omitted to turn the floor over to Mr. Jermaine Lake. He had a brief presentation, and we will do that and then conclude. Mr. Lake?
Source reduction is the main part, the main aspect of the mosquito control. Source reduction involves eliminating the breeding sites that Mr. Webb pointed out. It is the greatest challenge that we have. One of the things that Mr. Webb was alluding to was the fact that persons would make provision for buying the BOP and the other insecticides, not thinking about the fact that the dish tray holds some water. And what you find would happen is quite often persons, they spray their home, let's say 7:30 in the morning when they're leaving, spray all around thinking that they're eliminating mosquitoes, not thinking about the fact that there's a container in the house somewhere with water in it and larvae, and they spray, presuming that after spraying, after 8 hours when they go back home, there will be no mosquitoes. But what happens is that you have new mosquitoes emerging from these breeding places, as well as when the Ministry of Health, when we send out the fogging guy, the guys to do the fogging and so on, it kills the adult mosquito on the wing, and then persons, either they or their neighbors, have other sources breeding mosquitoes, and so within hours, new mosquitoes emerge, and then the next day they go to the health department and they say that the fogging ain't working, the BOP ain't working, or the mosquitoes enjoying the BOP and the fogging and so on. So that is the main issue, to reduce the sources, the breeding areas. If we could eliminate most of the sources of mosquito breeding, we would solve a major part, a large part of the whole equation for mosquito control. The guys over here is doing some other things as well, things like OV trapping. I think I saw a container over there, which Mr. Webb has. OV trapping, a simple little container, black copper, so we put some paper, some special paper in it, and it allows the eggs, the mosquito eggs, it's too tiny to be seen, but this paper has some eggs on it. It allows it allows us to capture the mosquito eggs, and it helps us to get an idea of how much mosquitoes are out there, which areas may have the Aedes aegypti, by the way. It's only the Aedes aegypti mosquito eggs that would stick on these, on some of these that we have. Aedes aegypti lays her eggs on the sides of containers as opposed to the other mosquitoes, which lay their eggs floating, free floating in the center of the water. So OV trapping is another activity which we carry out along with premises inspection. The officers go out and do inspection. They look for sources of mosquito breeding as well as potential sources of mosquito breeding, sources of mosquito harborage, because overgrown bush and so on would harbor mosquitoes during the course of the day, where the mosquitoes relax until later when you come home and they begin to bite you around sunset or sunrise in the morning. The OV trapping is to be carried out all around the islands, including and especially at the ports, because we want to monitor what mosquitoes may be coming in or catching a flight or catching a boat and leaving the country as well. The main focus there is Aedes aegypti, especially with Zika. We also do health promotion, not just the health promotion unit, which, by the way, has done a fabulous job with these pamphlets. I'm really impressed. The officers go to schools and other institutions speaking about mosquito control and Zika, chikungunya, and the other diseases of concern for us. And that is the second aspect of it, because people need to know, people need to be educated about the problems, the challenges with it. If we can get more persons involved, that would solve another big problem for us, because I suspect that one of the challenges solid waste has is that persons not aware and they're carrying on and being not aware, the problem sort of just continues itself. So we want people involved as much as possible in their health and in controlling mosquito. Then the third thing is chemical control, which involves the fogging, the spraying of BOP, the use of A-bait and so on. Chemical control is expensive and it does not always work, especially where persons have mosquito breeding in containers and we go around doing fogging. We only killing the adult mosquitoes, and you have the mosquitoes continuing to proliferate in and around premises and other places. I don't know if my colleagues on Nevis have biological control. That is some fish. At the health department on St Kitts, we have a pool with some fish, and we would put the fish in places where there might be water continuously, where we might not be able to pull these every day, or we're not able to compel someone to remove water. For instance, at the old estates and so on, you might have the large coppers. Coppers might be in stone or something, and we can't move the copper, and so we would put some fish in there. The fish would eat the larvae and pupae and control the mosquito population that way. Again, though, I reiterate, the most important aspect of the whole mosquito control program exercise is source reduction, and source reduction must be done mainly by the householders, and we need everyone on board. Police officers, by the way, are ex officio litter wardens, so they can issue tickets for littering as well. Vector control officers, I think, are ex officio litter wardens. Environmental health officers are ex officio litter wardens. And the act that you spoke about from solid waste, now the litter act is now encompassed in that. There is no longer a standalone litter act, but solid waste act, which has all the main components of the farmer litter act in it. So we need everyone on board. We need the police, we need the officers, and most importantly, we need the householders on board. If they don't get on board, we're not going to control mosquitoes at all.
Eliminate breeding today. Keep mosquitoes away. Here are some ways to eliminate mosquito breeding sources around your home. Tightly cover water drums, barrels, tanks, cisterns, and septic tanks. Safely dispose of buckets, old tires, and any other unused containers and objects that hold water. Scrub the inside of PET containers, flower vases, and dish drainers every other day. Remove water from flower pot saucers and replace with damp sand. Overturn buckets, watering cans, wheelbarrows and other containers and store them in a sheltered place. Adequately treat swimming pools and discard water from portable pools. Check roof gutters for chokes regularly. Fill up exposed tree holes, plant axils and ground depressions with sand. If you are going for a holiday, empty toilet bowls and tanks and cover gully traps. Reduce the source. Eliminate breeding today, keep mosquitoes away.